this next educational video, we are going to talk about a colposcopy. A colposcopy is where I visualize the cervix to try to find if there are any abnormal cells there based on an abnormal pap smear result. What it includes is that you come in for your normal exam, you'll go in the room, shimmy down like you're having a pap smear again. I put the speculum inside the cervix. I put some dilute vinegar solution on the cervix itself. The reason we do that is because the abnormal cells of the cervix take up the vinegar and turn white like a sheet. The whiter it is, the more abnormal those cells are, and it kind of like gives me a little X marks the spot, an area that I may want to biopsy so I can send it to the pathologist and they can look and comment on exactly how abnormal the cells are. Questions I often get about this is this going to hurt bad? And my answer to folks is it should not. The cervix has special nerves to it, if you will, where usually you're able to manipulate the cervix quite a bit without significant discomfort. We do advise that you not have intercourse for about a week afterwards so you don't experience any irregular bleeding. Also, after the colposcopy is done, I oftentimes put something called Mon cells on the cervix. It looks like honey mustard, but its function is that it actually makes a really good scab where I took that biopsy off. In that next week following your procedure, oftentimes you'll want to wear a panty liner because that honey mustard material mixes with blood, makes a good blood clot, but when it comes out of the vagina, it looks like coffee grounds and it will totally stain your underpants. So just be sure to wear a panty liner for as long as that discharge is coming out, and then you won't have any problems. Oftentimes we think abnormal pap smears come from HPV or human papillomavirus. Common questions I get about that is, but I got my Gardasil vaccination. I didn't think I could get an abnormal pap smear. But what you'll find is that there's over 100 different types of HPV. So just because you had your Gardasil doesn't prevent you from getting abnormal pap smears. And it also does not mean that the strain of HPV that's acquired that gave the pap smear the abnormality is going to give you condyloma or warts on the outside of your cervix. So what we do during a colposcopy is we look to try to clarify exactly how abnormal the cervix is within itself and make further treatment recommendations about how to keep folks safe and move on from this event.